There are cries of adoration as men from every nation lift their voice to make his glory known, singing, holy, holy, holy. Beloved, the angels are singing and we join in one accord and we lift our voice. There are men from every nation. That means my voice and your voice. Our voice must be lifted in worship to the heavens. Beloved, I ask you to join me every Monday from 5:30 p.m. on this live show. Your worship, your voice must be heard. Your voice.
First and the last, first and the last, Alpha Omega, Alpha Omega, never too late, never too late, always on time. Yeah, who can compare? Who can compare? Who can explain? Who can explain your works and your ways? Your love. I've never seen a God like you that can do the things you do. I have no one else but you. Jesus, I'm stuck on you. Last minute God, miracle worker. Last minute God, He'll never fail me. You'll take my fool, you'll come my fool, you'll come my fool, my last minute God. Covenant keep, you will never fail, you will never fail. You will never fail, you will never fail. Powerful protect, you will never fail, you will never fail. My healer, helper, provider. How could you love me? You will never fail, you will never fail me. Why did you choose me? You will never fail, you will never fail me. I give you my life, my all, lover of my soul. I've never seen a God like you. Never seen a God like you that can do the things you do. Do the things you do. I have no one else but you. Jesus, I'm stuck on you. Hey, I've never seen a God like you. Seen a God like you. my miracle worker, last minute God. You'll never fail me, no, no, no. You'll be my fool, you'll come my fool, you'll come my fool, yeah, me, my last minute God, last minute God, last minute God, miracle worker, miracle working God, last minute God. He'll never fail me, he'll never, never fail me, yeah. Oh, you'll be my fool, oh, you'll come my fool, oh, you'll come my fool, yeah, me, the last minute God. Oh, you'll be my fool, oh, you'll be my fool, oh, you'll come my fool, oh, you'll come my fool. It's right down there like Jesus Christ. Oh, you'll come my fool, yeah, me, my last minute God, last minute God. Yeah, it will never feel last minute God. It will never feel last minute God. Yeah, it will never feel last minute God. It will never feel last minute God. Yeah, it will never feel last minute God. It will never feel last minute God.
Welcome to Bread of Heaven International Ministries TV. Tonight we're here live on the Living Life Show with Mr. Patrick Mensah, specialist nurse in urology, discussing prostate cancer. Call your friends, call your fathers, call your uncles, your friends, cousins. Tell them to tune in. Stay tuned. Hello, good evening, Mr. Patrick Mensah. Live here on Bohem TV. So, what is prostate?
Right. So, so prostate is only it's a gland in only men, and it sits below the bladder, and it surrounds the urethra, which is the tube that we use to pass urine. And it's shaped like a walnut, so it's very small. And someone will say, what do we use it for? Basically, the prostate helps men to produce the fluid that comes with the sperm.
Okay.
So the semen.
So it relates to a man's fertility.
Absolutely. Yeah.
Right. What job does the prostate do for men?
So what it does is it helps to supply the liquid, or the fluid in the semen that helps the sperm to come out.
Right. What is the most common prostate problems in men?
So it gives men a lot of problems in that as you grow, like my hands, when I was small, they're small, but as we grow, it becomes bigger.
Okay.
So we get what we call enlarged prostate, which occurs a lot in men over 60 or over 50 years of age. After 50 years of age, most men have an enlarged prostate. Now, there's another problem that it gives to men. If it gets infected or inflamed, it's called prostatitis. And also, there's another problem which we're going to talk about today. If the cells in the prostate start to grow abnormally, they become cancerous. This is where we get prostate cancer.
Can you tell us what prostate cancer is?
Yeah, so basically it's the cells in your prostate which is growing abnormally, and it becomes so abnormal that you have some side effects, and like with all cancer, we have to try and get rid of it or treat it, or it will be problematic for us.
Well, viewers, I hope you are listening. Just take notes for them because it's very, very necessary. The prostate enlarges as you grow. What are the signs and symptoms of prostate cancer?
Right. So the signs and symptoms of prostate cancer are that all of a sudden what you see, most men see, is that you start to urinate a lot in the night. For example, if normally you go about twice, you see that you'll be going 4, 5, 6 times in the night. And then sometimes after you pass urine and you come out, you feel like you haven't emptied your bladder completely. So you want to go back again. Also, some men, when they go to pass urine, they dribble, or the urine comes very slow at the time. Or also the urine comes, it comes, it stops, it comes, it stops. And also for some men, some of the symptoms are that if they have to go to toilet, they have to rush to go, or they can get a leak, which is called incontinence. Now, this can also happen when your prostate becomes big.
Okay, that means it's over enlarged.
It's enlarged. Or it can also happen if you have a prostate cancer. Right. But on the other hand, the more serious one is that if the prostate cancer becomes so big that it starts to grow outside the prostate, it becomes what is called localized advanced cancer.
Okay.
Now, if it comes out of the prostate and goes in the bones and other organs, it's called advanced cancer. Now, when you get this sort of cancer, the problems you get is that it goes to the bones, the hip, the pelvic area, so you get lots of pain. Also with men, your erectile function is affected. So sometimes you can't have an erection, or if you get an erection, you can't maintain it. So it's quite problematic for men. And not just that, you also see blood in your urine. And with all men, some of the symptoms are, with every cancer, you start to see that you lose a lot of weight. So this is when you know that it's at an advanced stage, the prostate cancer.
Right.
So these are some of the things that, the signs and symptoms of prostate cancer. But with passing a lot of urine, if you're diabetic, you can sometimes also pass a lot of urine. If you have cancer in other parts of your body, you can lose a lot of weight. So some of these things can occur in other sickness. But for prostate cancer, you have to look out for these things as well.
Right. So for our men, our fathers, our brothers, our husbands, we want to tell you that if you experience any of these symptoms, it is best to consult your doctor.
Absolutely. Go and see your GP.
That's right. What is the incidence of prostate cancer in the UK?
Yes. It's good if you ask about the UK, but let's just go further to like the whole world. Um, I'm reading and researching, it shows that about 1.3 million men in the world get prostate cancer every year. So it's quite a massive.
Can you repeat that
undertaking.
statistics?
1.3 million men.
1.3 million men
Yeah.
are prone to get prostate cancer yearly.
Yeah.
So you should be taking good care of yourself.
Yeah.
Shall we proceed?
And if we look at US, the American Cancer Society says that every year there's about 200,000 men get prostate cancer. And out of this, about 33,000 will die. 33,000 men will die every year from prostate cancer. Now, if we come to the UK, the whole of UK, there's about 47,500 men, according to Prostate Cancer UK. We did a survey in 2018. Now, out of this, at any point in time, about 400,000 men are living with prostate cancer. Every 1 in 8 men in UK will get prostate cancer at some point in their life.
1 in 8
men in the UK. And if we come down to just England alone, about 40,000 men in the UK get prostate cancer every year. 40,000 men, and every hour, a man dies from prostate cancer.
That's alarming.
That's alarming, yeah. In a year, about 9,000 men will die from prostate cancer, and at each time, about 325,000 men are living with prostate cancer.
I know we have spoken about death and erectile dysfunctions, but what are some of the other risks related to prostate cancer?
So the other risk related to prostate cancer is age related. So it's a disease that occurs a lot in older men. So men who are over 65, but it can sometimes occur in men who are 50. But very rarely it can also happen in men who are in their 40s. So what we need to do is to make sure that if you get over 50, you have to go to your GP and get a check, ask for a check of your prostate and get it sorted. The other thing too we need to note is that it affects Afro-Caribbean men more.
Okay.
Yeah. So for example, if you're Black and Afro-Caribbean, the incidence is about 2.5 times more.
Why is that?
Because it's genetic.
Okay.
So if your brother or your dad had prostate cancer, then you have to go and get it checked early in your when you're 45 or 50. But more so, if it happened to them when they are below 60, then you have to go very early to your GP or your health service and get them to check it early for you. And also looking at the genes as well, any family with breast cancer, for your mother or your sisters, there's a gene called BRCA1 and BRCA2. Now, that gene that causes breast cancer can also cause prostate cancer in men.
If you have experienced breast cancer in your family and you are a male, make sure that from the age of 40, you start consulting your doctor for a checkup.
And also, one thing which is important that I need to add is that research has shown that it's good to eat. It's good to live a healthy life, because if you're very overweight and you get prostate cancer, the cancer you tend to get other aggressive cancers which spreads very fast. So it will be in our interest as men to eat a healthy life, exercise, and be in shape and in weight. So even if they get a disease, it won't be too aggressive.
Right. Are there tests done to diagnose prostate cancer?
Very good. This is where I ask all our men that if they get any of the symptoms we've talked about, they should go straight to their GP and get all this test in motion. The first thing your GP will do for you is it'll give you a small bottle to give them a sample of urine. So we'll test the sample of urine to make sure you don't have any urine infection. Once you don't have any urine infection, then we can continue with the other tests. What other tests do we do? They will also feel your prostate through your back passage with the glove finger of the doctor. When they feel your prostate, like your forehead is very hard or your nose is very rough. If it's these two, then there's a suspicion there might be prostate cancer, or there's a suspicion for prostate cancer. If it's as smooth as your lips, then it's okay. And also by feeling your prostate, they can tell whether it's a big prostate or small prostate. So once the GP have done this, if there's a suspicion and if they are worried about your family history, then the next thing they might ask you to do is to do a blood test. It's a simple blood test called the PSA test. It's in our prostates, it produces proteins when they do the blood test. So the level of the protein will tell us whether if it's too high, then there's a suspicion for prostate cancer. Now, if you are in your 40s and it's more than 2, then we worry. If you are in your 50s and it's more than 3, then we worry. If you are in your 60s and it's more than 4, then we worry. So there's a cutoff point where we look at in relation to your age. But there are other factors that can also affect the PSA test as well. For example, if you ejaculate just before you have the test, it might give a false reading. If you do a vigorous exercise like go on a bike or jogging, and as soon as you come, you do the PSA test, it might affect the reading. If you have a urine infection too, it will let it go a bit high. And there's some tablets they take for helping people to pass urine, like finasteride, so that doubles the PSA. So the doctors will look at all these factors to make sure that you don't have any of this before they look at the reading and work with the reading that they have. So when you see your GP, they will also look at the risk factors that we talked about, like your age, your family history, your ethnicity, your weight, and they'll look at all those risk factors as well.
Right. If you have just tuned in, welcome to Living Life Show on Bohem TV. We're here tonight with Mr. Patrick Mensah, specialist nurse in neurology at North Middlesex Hospital, and we are talking about prostate cancer. So, Mr. Patrick Mensah, can you tell us the different types of treatment for prostate cancer?
Okay. So before I go into the different types of treatments for it, once you've seen your GP and they've done those tests, if they are worried, then they will refer you to the hospital. Once you come into hospital, then you see a specialist called the urologist doctor. Now, this doctor will also do the same thing your GP did, or you'll look at the results of your GP. If he wants to, he'll get you to do another urine sample just to make sure you don't have any urine infection.
Right.
He will also examine you, and also he will take a detailed history and a general history to see whether you have other medical problems as well, so that in future, if we want to treat you, we know that you are healthy or you're not healthy, or we know how far we can treat you. Once they've done all of this and the digital rectal examination, if they've got a suspicion that you might have a prostate cancer, then they order a test called the MRI scan of your prostate. This is a magnetic resonance imaging scan, which takes x-rays of your prostate using magnets to see whether you have prostate cancer in them. It can also tell us whether the prostate cancer is inside the prostate or it's coming out of the prostate.
All right.
Yeah. So it's very good, and it gives us detailed information. It can tell us exactly where the prostate cancer is, whether it's coming out, whether it's gone to the bones, or how far it is. So we can know from the MRI scan what's happening.
Right. So what are the side effects of the various treatments of prostate cancer and the practical tips on how to manage them?
Yeah. So basically, once they've done that, if the MRI says that there's cancer, then what we'll do is we'll do a biopsy. So when we do a biopsy, we use the ultrasound scan to find where this MRI scan say the prostate is, and we take some tissue samples, and we send it to the lab. So with all of these tests that you do, if you do a blood test, sometimes when they do blood tests, it's uncomfortable. But there's a goal at the end with your PSA blood test. If you do an MRI prostate scan, some men can get quite claustrophobic because you lie down and you go in the machine. So if you don't want, if you have someone who's very claustrophobic, you can ask that they do an open MRI scan, which is more expensive. But it might not be in all the centers that you go, but it's an option you can ask.
Right.
And also when they do the prostate biopsy, there's a small risk. There are different types of biopsy. There's a transrectal biopsy, there's transperineal biopsy, there's a template biopsy. All of them have their own risks.
Okay.
But most commonly with every biopsy, you can get a urine infection.
Right.
You can also go into what we call acute urinary retention. So after the biopsy, some men don't pass urine.
So you need a catheter.
So you might need a catheter. Very
Right.
good. Some men also have problems with their ejaculation.
Okay.
Because once we poke the prostate, when you ejaculate, you might see a blade of blood in it. So we'll tell you that beforehand.
So that takes a little bit of time
To clear, yeah. And also we will also tell you about all these problems that you might have, but the goal is to find out what's exactly happening. And especially if you have this disease in your family and you're worried about it, you're having sleepless nights and all these problems, it's good to know what the biopsy will tell us. And once we know the results of the biopsy, then we know how we can treat you. So we let patients know. One of the things we do with the biopsy is we can give you antibiotics after the biopsy. If you're diabetic or if you come back with any infection, we can tell you for some signs to watch out for, like signs like sweating a lot, having a temperature after the biopsy. You can come back or call us. Every hospital will give you the numbers of the specialist nurses. So you can call them if you have any of this problem. And then you come back and then they will check your urine again and give you the appropriate antibiotics.
Right. So what is advanced prostate cancer?
Yeah. So advanced prostate cancer, in cancer, prostate cancer, there are three types of prostate cancers. There's localized prostate cancer, there's advanced localized prostate cancer, and there's advanced prostate cancer. So I'll probably like to break it down a bit for the viewers. that would help us. So the localized prostate cancer is after we've done all of this and we've taken the tissue, we send it to the lab, and there's someone who looks at how the tissues of the prostate grows. That's called a histopathologist. So he will look at the growth, how the biopsies grow, or the tissues from the prostate grows, whether they grow very slowly, which in most cases is the case, or whether they grow very fast, or whether they grow like in the middle, medium. So the ones that grow slowly are the localized prostate cancer. Now, how do we know their grading? There's a system called Gleason. So like with everything, we have left and right. So we have the left side and the right side of your prostate. So the measurement starts from 3. 1 and 2s are not considered to be cancerous. So the measurement starts from 3 to 5. So if you take the left side, which is 3, and the right side, which is 3, which is the localized, slow-growing cancer, it's called Gleason 6. So they take all the biopsies, take the common ones, which is the 3, and take the highest of all the readings that they've got. And then if it's 3 and 3, it's called Gleason 6. If you get, the grading starts from Gleason 6 to 10. 6 is the lowest grading, which means it's localized prostate cancer. 7 is medium, so it's locally advanced prostate cancer. From 8 to 10 are more advanced prostate cancer. So that's how we get the advanced prostate cancer.
Right. If you have just tuned in, welcome to Bohem TV, live here in our studios in Edmonton. We are with Mr. Patrick Mensah, specialist nurse in urology, and we are discussing the topic prostate cancer. So let's talk about the treatments for these kind of cancers.
Very good. So the first one, which we talked about, the localized prostate cancer. So these ones are very slow growing. So for some patients, if they've got a lot of comorbidities, like they've got blood pressure, they've got diabetes, they've got lots of several illness and
underlying conditions.
Sometimes we can watch and see whether this will grow or be, or it will stay as it is or it will grow. So the localized prostate cancer is inside the prostate. It hasn't come out of the prostate. Sometimes it could be just in one side of the prostate.
Just to interject, which one is more dangerous, inside or outside?
If it's inside, it's good.
Okay.
Yeah.
It can be managed.
Yes, absolutely. So if it's inside, it's good. It can be managed. So we keep an eye on it. Like the PSA we talked about, we check it regularly every 3 to 6 months. And then we do an MRI scan as well, MRI prostate, to see if the disease is still the same. So this is called active surveillance. So you watch it and see for about a year, 2 years, or 3 years. If it stays the same, then it's fine. So this will be discussed with the patient to see whether they want this. If at any point in time it changes and it becomes very fast-growing cancer, prostate cancer, then we act straight away. We take a biopsy and we give the treatment. Now, in terms of localized prostate cancer too, another form of treatment is the surgical side of treatment. So if someone says very fit, very young, or prefers to have surgery because the disease is there and is always thinking about it, the doctors will go through everything with them, and then there will be an operation to remove the prostate completely. There are several types of operation to remove the prostate. And this operation is called radical prostatectomy.
Radical.
Yes, because you completely take the prostate out. Now,
wow.
You can do it, the old way is they open you up. So it's an open prostatectomy. Or, more recently, we can use keyhole.
Okay.
So keyhole surgery. Or now, in advanced countries, they can use a robot, which is called the Da Vinci robot. So robotic prostatectomy. So that can also be used to remove the prostate. Now that one is the gold standard now, and a lot of big centers are doing it because when you do the robotic, you lose less blood.
Right.
And also the robots do fine precision surgery. So the nerves that supply the male organ, the penis, to help with the erection, you can spare it as well. But if you're doing open surgery, it can be difficult. So the advantages of the robot is probably better. And there's less blood loss, less mortality as well. So that's one way of treating the localized prostate cancer. Now, if the patient wants to, they can also have external beam radiation, so radiotherapy. So high energy X-rays are used to burn the prostates.
Right.
Yeah. And this can be done in sessions, but it also has its side effects as well. Some patients can get incontinent, they can get problems with their bowels. So they'll tell them all the pros and cons. There's another form of treatment called brachytherapy.
I've heard that.
Yes, very good. So the brachytherapy, they'll put the seeds in the prostate therapy.
Welcome to Bohem TV. This is the Living Life show, live in our studios in Edmonton, and we are discussing the topic prostate cancer with a specialist urology nurse in North Middlesex Hospital, Mr. Patrick Mensah. I just want to encourage you to like and share the video because it can save a life. Thank you. What is advanced prostate? Sorry, I've asked you that question.
Sure.
So how can families and friends help men with prostate cancer?
Yeah. Most men, I've been one of them, most men normally have this macho feeling and they don't want to go to their GPs. What would like to emphasize to everyone hearing us is that if you get any of these symptoms that we talked about earlier on, any urinary symptoms or any worries or anything, please book an appointment with your GP. Please go and see your GP. Wherever you are listening to us in the world, whether it's your GP or your hospital, your local hospital that you can go to. In England, go and see your GP. But in Africa, if you need to go to your hospital, go to your hospital and see your doctors. They will check you. It might be it's just a urine infection and you get treated. It might be that you have an enlarged prostate. So there's treatments for that and investigations for that. Or it may be a prostate cancer. And the earlier we find it, the earlier we deal with it, the earlier it is better for you. And how can your family help you? It's always good to ask your wife, or your partner, or your sisters, or anyone to come along with you. Because sometimes when you go to see your doctors and you ask questions or they talk through a lot of things with you, sometimes you can't ask what you want to ask, or you forget everything when you come out.
But during this coronavirus period, they are not allowing.
Okay. So that now the world is changing with everything happening. So you make an appointment by telephone and you speak to the doctors, and they can always send you the forms for the blood test, and then you do the blood test, and they can ask you all the symptoms and look at the risk that you have, and based on that they can refer you to the hospital, because the hospital are seeing patients at the moment. They are making sure that although the coronavirus is going on, patients with prostate cancer, patients with any form of cancer are not left behind.
Okay, so wives, sisters, when your partner begins to complain about some of these symptoms, encourage them to see the GP. How does prostate cancer affect sex and relationship during diagnosis?
So most of our men, once they've been diagnosed that they have prostate cancer, some of them take it differently. Some of them take it in their stride. They work with their partners, they work on things, and some of them, they just shut down. They don't want to talk to anyone. They completely feel that that's the end of their life.
It's not a death sentence, right?
No, it's not a death sentence. So they need to speak to the key workers in the hospitals here. We have nurses who are key workers. If they have problem talking about what they've just been told, they can speak to the consultants, urologists. They can speak to their GP. There's helplines for men who have prostate cancer, like Prostate Cancer UK, like Macmillan UK. They have helplines in the hospital. We have counselors. We have psychotherapy. We have psychologists who can help you talk about it. And also, it's always important to come with your family members and your wives to this function, so that together you work together. And once it's good to talk, because once you talk, it will help you. And actually, there are communities who, during this pandemic, I've got societies that you can phone and speak to people who've had this experience before.
We'll take a break and we'll come back. Stay tuned.
There are cries of adoration as men from every nation lift their voice to make his glory known, singing, holy, holy, holy. Beloved, the angels are singing, and we join in one accord and we lift our voice. There are men from every nation. That means my voice and your voice. Our voice must be lifted in worship to the heavens. Beloved, I ask you to join me every Monday from 5:30 p.m. on this live show. Your worship, your voice must be heard. Your voice.
11 live show live on Bohem TV in our studios in Edmonton, UK. Tonight we're discussing the topic prostate cancer, and I want you to call your friends. That is, if you have just tuned in, tag your friends, like and share the video. It can save a life. Mr. Patrick Mensah, thank you for being with us all these weeks.
Welcome.
So, as we're talking about how people take the diagnosis and the role that family and friends
And
can
medical,
play
yeah.
in helping them deal with the situation. Can we elaborate more on that?
Yeah. So, as I was saying, it's very important that our men come along with their family members. It's very important they come with their wives. It's very important that they continue to seek help from the doctors, because sometimes when you are given this information and you leave, you feel that your world has come to an end, because you're thinking about your family, your children,
wife.
your wife. Are you going to die? What's going to be left of you? You probably haven't done your will. And what sort of life are you going to live from now on? How is it going to affect you? If you're very young, is it going to affect your marital life? If you don't have any children, is it going to affect your ability to have children with all these treatments and everything? So it's a lot that the men that have been told have to take. And you know, as men, sometimes we don't like talking a lot. And this is where the women can help us, the family members can help us. But sometimes too, you have to give them some time to take
To
this
process
in,
it.
to process all of it, and then but help them along to seek proper help. Speak to the key workers who are the nurses. Speak to the consultants. Seek help if they're really, really down. There are help that we can offer them in terms of psychology, psychotherapy. Even the hospitals have places where they can go for massage. For the Macmillan centers can also offer them some financial help as well for cancer patients.
Right.
They link in with like sports bodies and football bodies to give these patients exercises which can relieve them and relax them. We also advise the patients to look after themselves, not just neglect themselves, because we're there to help them, and we will go with them all the way to make sure we help them to come to terms with the disease, to get over it, and to help them to live a good life after they are diagnosed.
Well, there is help available, so you don't need to stay in your corner and feel sorry for yourself. We also want to encourage wives, sisters, friends living with people who have received such a diagnosis. It can be such an overwhelming experience, and your cooperation and support will be very much appreciated, and also, I believe, help in the
in the
early-
healing process,
Yes.
yeah, and come to terms with the disease, because whatever happens to you, the family unit is very important, because if this is put to you, it will hit you like a ton of bricks, but it's not the end of the world. There are communities where, like for example, Prostate Cancer UK, if you go into their website, they've set up communities where people who have the same disease, you can talk to people who have the same disease, their experiences of what happened to them when they were told, and how far they've come to the type of treatment that they have. So if you're going to have any of this treatment, for example, if you've just been told, by talking to some of these men, you know what treatments, what it entails, and the side effects and everything, and how they overcame it, and how you can also overcome it. So by speaking to another patient in these forums, it will help. And also, like Prostate Cancer UK have got specialist nurses who are waiting to speak to anyone 24 hours, 24/7. Macmillan Help Center, Prostate Cancer UK, Cancer Research UK, they have helplines to help. And also in every hospital, there's a key worker called a nurse who specializes in prostate cancer, or your urologist or your GP. So the medical profession is there to help you, and we'll do everything we can to help you through your journey.
Help is available, and you are encouraged to seek the help needed. How does treatment for prostate cancer cause fatigue in men?
Yeah, so for men, when they have for example, the surgery. After robotic surgery to remove the whole prostate, it's a major surgery. It's just that these days, most of the surgeries, because it's done by robots, it can be done within few hours. But in the past, it's an operation that can take hours, and then you end up in ITU. So when you come over all of this, you're completely drained, and then you wake up and suddenly you see a catheter that you've never had all your life for about 50 or 60 years, and then suddenly you have to deal with it. And then you also have some come to terms with the operation, the fact that you lost your prostate, the fact that you're going to have an erectile problem. So we have specialists who deals with erectile dysfunction. So we have erectile dysfunction nurses and some medication that they can help you with that as well. Then if you have surgery, your wound has to heal.
Yes.
Then you have to recover fully, start walking again, being able to go back to work, recover, being able to work, all those things. So you have to take it a step at a time. Like if you have surgery, then if you have radiotherapy, there are other effects that you can have, like incontinence and bowel problems that you have with radiotherapy. So we'll talk you through all of this and what you can do to help you with this as well. So there's some medication that they can give you to help you if you get incontinence of urine or feces after radiotherapy. And then the patients will also have the active waiting, the active surveillance. So we keep an eye on your PSA. Every 6 months we do your PSA test, or every year we do your MRI scan to make sure that if the prostate starts to grow straight away, we call you back and we make sure that we give you the necessary treatments that we can to help you. So at any point in time, once you come into hospital and we diagnose you, we are with you all the way. And actually what happens is that once you are diagnosed, all this report goes to a place called the multidisciplinary meeting. And this place has got a urologist, it's got a specialist nurse, it's got an oncologist, a histopathologist, and a radiographer who will talk about your disease and how to treat you. So your treatment is not just based on your urologist. There's a team looking after you. And if your disease even progresses, there's another place called the specialist multidisciplinary meeting. For example, in here in North London, the center is UCLH.
Okay.
So you can get there. They have professors, they have consultants, about 40 consultants or 50 consultants, talking about your prostate cancer and how best to treat you. So it's not just your urologist who will treat you. So you get about 50 consultants coming together to say this is the best way we can treat you. So whatever problems you're going through, go and see your GP and come into hospital, because the best people in the profession are waiting to help you.
The best people in the profession are waiting to help you. What are you waiting for? Call your GP, make an appointment, and get yourself checked. Welcome to Living Life, live on Bohem TV with Mr. Patrick Mensah, a specialist urology nurse at North Middlesex Hospital, and we're discussing the topic prostate cancer. What are the urinary problems faced by men who have prostate cancer, and how can they be helped?
Yeah, so as we discussed earlier on, some of them have problems because when the prostate grows, because it's near the urethra, when it grows near the urethra, then it affects how they pass urine. So some of them pass a lot of urine at night, and some of them too, when they pass urine and they come out, they want to go back again, because if their prostate is big and cancerous, then it blocks the urine from coming out.
Okay.
Yeah. So in addition to having the prostate cancer treatment, they can also have treatments to open their prostate and help them to pass urine better. There are tablets that they can be given to help them to pass urine better. And there's also other tests as well that can be done to find out why they're having urinary problems, and different tablets to help them as well.
Right. What medical professionals and organizations can help men with prostate? I know you have mentioned Macmillan, but can we just go over that again?
Yeah. So the medical the medical professionals start with your GP. So you go and see your GP if you're in UK. Then if they think that you have prostate cancer, they refer you to the hospital. With every disease, it has a specialist in that field. So with prostate, you have the urologist. So you see a consultant urologist, and in the hospital, they do a clinic called a one-stop prostate clinic. So for example, every hospital, every week, some do it once or twice a week, where all the prostate cancer patients come and see the urologist. And that is where your treatment starts. Once we've diagnosed you, you come across a radiologist who will do your scan and interpret the scan, like your MRI prostate. You come across a histopathologist. So when we take a biopsy from your prostate, they will look under the microscope to see how fast these cancers grow. And also an oncologist. So if you have to have radiotherapy treatments, the oncologist will look at that. So all these people will come to a meeting once a week and discuss every patient who has prostate cancer, their MRI scans, their results from the prostate biopsy. Then they'll also look at the MRI scan in detail, the results of the biopsy, and everything about the patient, how their health, their general health, whether they are at risk in terms of their family history and everything. And then they will come up with a plan, which is called a treatment plan for the patient at the multidisciplinary meeting. So this is just locally for the hospital. Now, if the disease is locally advanced, it will not just go there. It will go to a national center.
Okay.
For example, in North London, we have a national center where it will go to. So not just your consultant, or in your hospital, about 4 or 5 consultants deciding, but in the specialist center, you get about 50 consultants, plus the other hospitals as well. So you get about 60 consultants deciding on the best treatment for you. And there are professors as well within this as well. So you are in safe hands.
Right. If you are in the UK, you do not have an excuse. But if you are watching from other parts of the world, Africa, anywhere in the world, if you're watching us, still visit your doctor if you're experiencing symptoms and get yourself checked. Our final question for the night, or for the evening.
Yeah.
What is the take-home advice that you will give to all men who think they might be experiencing prostate problems?
Sure. So the best advice I can give to all men is that in the UK, this is the number 1 killer for men, the number 1 cancer that kills men. And also for most men and Afro-Caribbean men, because the incidence, even in just UK, is 1 in every 8 men will get prostate cancer. And for Afro-Caribbean men, 1 in 3 men will get prostate cancer at some point in their life. So if you get any of these symptoms, do not hesitate to go and see your GP. And your GP will do all it takes. It might just be a urine test will show that you have a urine infection, and you get antibiotics after they've sent your urine off and know the right antibiotics to give you. Or it might be your prostate is big, in which case there are treatments that they can give you and tablets to help you with this. This is the simple cases. It might be your prostate is inflamed, so they can give you medications and things to do to help that. Or it might be you have the prostate cancer. Now, if you're lucky, your prostate cancer might be slow growing, in which case it will take a lot longer for all the symptoms to manifest. But by just going, they would identify you and refer you to the doctors in the hospital, and they'll find you have this prostate cancer. If it's just in your prostate, we can keep an eye on it, monitor it, or we can take it out, or we can treat it for you. Now, if it's come out of the prostate, then there are other treatments as well for it, but you must not sit at home, because this is a silent killer. It's a slow killer for the men. So come out, men. Even during this corona period, just ring your GP, make an appointment, tell them your symptoms. They will send you a blood form, they'll do the referral, and the hospitals are waiting to help you. If you live outside UK, in Africa, go to your local hospital and talk to them about this disease, because you don't have to suffer in silence. And particularly if your mother had breast cancer, to go and speak to your doctors. If your brother, if your uncle, if your dad had prostate cancer, then run to your GPs and make sure that if you have the symptoms, they check it for you, because there's treatment out there, and we are ready to help all men. The GPs are ready to help, the urologists are ready to help, and the health system is geared towards helping our men. So we are waiting with our arms open. Come and we'll help you.
We're waiting with our arms open. Come and let us help you. Those are the final words of Mr. Patrick Mensah, specialist nurse in urology at North Middlesex Hospital. If you have just tuned in, welcome to Bohem TV, and it's the Living Life show live in our studios in Edmonton, and we have been discussing the topic prostate cancer. The statistics are real. 1 in 3 of people from black
and
ethnic minority backgrounds are prone to get prostate cancer. It is the number 1 killer in men. 1 in 8 men
in
the UK will get prostate cancer at a point in time. You need to call your GP, book an appointment immediately, and get yourself checked. Especially if you are from the age of 40, get yourself checked. If you have also had history of breast cancer in your family, if you are male and your mother, your grandmother, some females in your family have had breast cancer, run and get yourself checked. Even if there is no history, it is a number 1 killer of men, and we don't want to lose our men. So run and get yourself checked. This is Tina K, who has been your host tonight, and I believe this has been a blessing. God richly bless you, and see you next week. Bye-bye.
Thank you.
Thank
There are cries of adoration as men from every nation lift their voice to make his glory known, singing, Holy, holy, holy. Beloved, the angels are singing, and we join in one accord and we lift our voice. There are men from every nation. That means my voice and your voice. Our voice must be lifted in worship to the heavens. Beloved, I ask you to join me every Monday from 5:30 p.m. on this live show. Your worship, your voice must be heard. Your voice. There are cries of adoration as men from
First and the last, Alpha Omega, never too late, always on time. Yeah, who can compare? Who can explain your works and your ways, your power and your love? I've never seen a God like you that can do the things you do. I've else but you. Jesus, I'm stuck on you. Last minute God, miracle worker. Last minute God, you'll never fail me. You'll be my fool. You'll come my fool. You'll come my fool. Yeah, my last minute God. Covenant keeper, you will never fail, you will never fail. Mighty deliverer, you will never fail, you will never fail. Powerful protector, you will never fail, you will never fail. My healer, helper, provider. How could you love me? You will never fail, you will never fail me. Why did you choose me? You will never fail. Can you tell me? I give you my life, my all, lover of my soul. I've never seen a God like you. Never seen a God like you. That can do the things you do. Do the things you do. I have no one else but you. Jesus, I'm stuck on you. Hey, I've never seen a God like you. Seen a God like you. That can do the things you do. Do the things you do. I have no one else but you. Jesus, I'm stuck on you. You the last minute God, my miracle worker. Last minute God, you'll never fail me. You'll be my fool. You'll come my fool. You'll come my fool. Yeah, me, my last minute God. Last minute God. Last minute God. Miracle worker. Miracle working God. Last minute God. He'll never fail me. He'll never fail me, yeah. You'll be my fool. You'll come my fool. You'll come my fool, yeah, me. The last minute God. Oh, you'll be my fool. You'll be my fool. Oh, you'll come my fool. You'll come my fool. It's right on very my Jesus Christ. You'll come my fool. My last minute God. Last minute God.